Thao and I am a psychiatric mental health nurse practitioner. I'm so excited to be here today hosting today's seminar on mental health stigma among Asian Americans.
佢嘅名叫 Thao 啊，佢係一個心理嘅護士，佢今日咧就同你哋講呢啲課程。
Being Asian American myself, this is a topic that I hold very near and dear to me. But before we get started, I want to share with you a little bit about where I work and some of the services that we offer.
OK， 佢開始之前咧，即係介紹下佢哋有咩服務。佢都係一個亞洲人，佢係越南人嚟嘅。
Health Partnership Clinic is a federally qualified health center, or FQHC, meaning that we serve a medically underserved area and populations.
OK， 佢話呢個咩 QFC 啊，佢係專係有啲服務咧，都係為啲亞洲人服務啊咁嘅。
FQHCs provide primary care services regardless of a patient's ability to pay.
OK， 佢咧呢啲QFC 佢哋咧就啲服務咧就睇你啲人有冇能力俾錢，按照你能力嚟俾嘅。
At HPC, we do offer a sliding scale fee for uninsured patients as well.
What is it?
At HPC, at Health Partnership Clinic, we do offer a sliding scale fee for uninsured patients.
OK， 如果啲病人咧佢哋冇保險嘅時候咧，佢就按照佢哋嘅收入嚟付嗰啲帳單。
So I wanted to highlight some of the populations we serve. 59% of our patients are uninsured.
佢而家講下佢啲客人嘅情況。佢59%嘅嗰啲病人咧，佢哋都係有時都係按照佢哋收入嚟俾嘅。
32% of our patients speak a language other than English.
32%嘅病人咧，佢哋都係講另外個人言語，即係唔係英文係佢嘅母語，講另外個言語嘅。
And 51% of the population is actually Hispanic Latino.
51%嘅病人咧都係嗰啲墨西哥或墨西哥種類嘅人。
Our clinics are located in Olathe, Shawnee Mission West High School, Paola and Ottawa.
佢哋啲診所咧有好多地方喺 Olathe、Shawnee Mission、Shawnee Mission 西邊嗰個高中，同埋 Paola 嘅城市，同埋 Ottawa 嗰度。
We offer primary care services, including family and pediatrics, women's health, and chronic disease management.
OK， 佢哋主要咧就服務咧係啲家人啊，同埋有時細路仔啦，女人嗰啲健康啦，同埋有啲慢性病嘅，點樣管理佢哋慢性病嘅。
We also partner with local pharmacies to dispense medications at discounted prices.
OK， 佢又同即係附近嗰啲藥房嗰啲，如果佢哋有困難俾買藥費嗰時咧，就佢哋會幫助下嘅，有優待嘅。
In order to best accommodate to our patients, we also offer same-day appointments as well as telehealth appointments.
OK， 為咗好啲對啲病人嘅服務，佢哋咧有即係你如果即刻打電話過嚟咧，即刻可以睇到病，同埋有時咧你唔方便去咧，佢都可以視頻嗰度睇你嘅。
For patients whose primary language is not English, we also utilize over-the-phone translation services.
如果佢嘅主要嘅言語即係母語唔係英文嘅時候咧，佢哋都會有翻譯嘅幫助你哋啲病人嘅。
HPC also offers dental care.
OK， 呢個 HPC 咧，佢又有幫助你哋嗰啲睇牙㗎啦，牙科啦。
And finally, we offer behavioral health services, including integrated behavioral health and therapy.
OK， 同埋佢哋有啲其他啲服務，即係嗰啲行為健康或者嗰啲其他嘅服務，佢哋都有嘅，同埋物理治療佢哋都有嘅。
We also have a substance use counselor here 3 days a week who offers individual and group therapy for patients with substance use disorders.
OK， 如果你哋有啲病人，佢哋有啲上咗癮嘅嗰啲咧，佢哋都有嗰啲服務俾你哋
As a psychiatric mental health nurse practitioner at HPC, my role is to assess, diagnose, and treat patients with mental health illnesses, including depression, anxiety, ADHD, to name a couple.
OK， 佢話咧，佢係個心理嘅護士啲人員咧，佢哋即係除咗睇病之外，佢哋有時都會睇啲病人，佢哋有行為運動行為問題 或者佢哋有嗰啲好動症啊，嗰啲其他種種病佢都會睇嘅。
I also collaborate with our substance use counselor to provide medication-assisted treatment to patients with substance use disorders as well.
OK， 如果有啲病人佢哋係即係好酒啊，或者毒品啊嗰啲咧，佢都會有醫療方法幫助呢啲病人嘅。
So I've been in practice at HPC for almost a year, but have been working in the mental health field for 5 years.
OK， 佢同呢個公司咧只係 HPC 做咗大概1年，但係佢以前咧都係同嗰啲其他啲公司係做嗰啲心理病嘅嗰啲，做咗5年啦。
I formed an interest in this field when a family member of mine was hospitalized in patient psychiatric when I was in high school.
當佢喺讀高中嗰時咧，佢有個家庭嘅親戚咧係有啲精神病啲問題，所以佢就有對呢方面有啲興趣，所以就專做呢科嘅。
I don't remember much, but what I do recall is how difficult of a time her healthcare providers had in communicating with my parents about her condition and her treatment plan.
OK， 佢唔記得好多，但係佢記得咧，醫生醫佢嗰時咧，佢個親戚咧就係同佢父母傾偈嗰時有困難，因為佢哋唔係講英文，所以佢就明白即係有言語上嘅困難。
My parents, being Vietnamese immigrants themselves and whose primary language is not English, had just as difficult of a time communicating back to her providers.
有時佢父母咧，因為係越南嚟嘅移民，所以佢哋咧英文咧就唔係佢嘅母語，所以佢哋有時同嗰個醫生即係護士傾偈咧就好難溝通啦，因為唔係講英文嘅。
As a result, and for many years, my parents didn't have a firm grasp on mental health and still struggle sometimes to talk about it.
所以佢父母咧對呢個精神病呢方面咧都唔係好清楚，所以有時都好難再係講呢啲嘢。
After this experience, I made it my mission to be a healthcare provider that not only provides culturally competent care to members of diverse backgrounds, but to break mental health stigma.
OK， 所以之後咧，咁就決定咗佢就要即係專讀呢個精神病呢科，同埋幫助啲人，唔理佢哋係邊個國家嚟嘅，所以佢即係明白佢哋點樣解釋㗎，咁唔使啲人即係叫做咩誤會佢哋。
So now that I've shared a little bit about myself, I was wondering if any of you had any experiences with mental health stigma that you would like to share?
佢話而家我講咗關於精神病呢啲介紹咗，咁你哋啲聽眾嗰度有冇人有即係經歷過對精神病呢方面嘅事情咧？又可唔可以當佢哋大家分享咧？
So my experience is sadly the reality that many Asian American and Pacific Islanders face, which makes it even more important to bring attention to this topic.
佢話覺得咧，因為我哋啲亞洲類嗰啲人咧，佢哋話好多時咧，佢哋都好難即係出口講話關於精神病呢啲咁嘢，佢都明白嘅。
So the purpose of today's presentation is to first explore the causes of stigma surrounding mental health in Asian Americans.
OK， 今日咧第一個我哋主要點咧就係要睇下點樣影響到關於精神病呢科，即係啲亞裔嘅人。
The impact of stigma on their health.
呢啲咁嘅病咧，同關於對佢哋嘅身體健康點樣
existing barriers, and what we can do to break mental health stigma.
同埋有咩嗰啲阻擋嘅困難，同埋我哋點可以即係再學多啲呢啲精神病嘅嘢，所以就唔會話俾人誤會咁啊。
I first want to start off by sharing some interesting statistics that I found. Asian Americans make up 5.7% of the US population.
OK， 佢先講一啲呢啲大概嘅內容。佢話喺美國嗰度咧，大概5.7%嘅人口咧就係亞裔嘅。
13 million US residents were born in Asia and make up about 30% of the total foreign-born population.
呢個美國咧就有13個1300萬嘅人住喺呢度咧，就係喺亞洲嗰度出世嘅。咁大概有呢度咧就包括喺30%嘅 即係全美國有30%嘅人口咧，都係喺外國出世嘅。
In a case study, 69% of Asian Americans did not seek mental health treatment, compared to 64% Hispanics, 59% African Americans, and 40% white Americans.
佢哋已經有啲研究咧，佢話69%個亞裔嘅美國人咧，佢哋都唔會去揾嗰啲精神病嗰啲醫療，同埋咧比較咧就嗰啲墨西哥裔嘅人咧，佢哋有64%啦。美國嗰啲黑人嗰啲咧有95%，同埋白人咧就40%，佢哋都唔去揾嗰啲精神病嘅醫療嘅。
Among the Asian Americans with a diagnosable mental health disorder, only 28% utilize mental health services.
當佢哋即係調查嗰時咧，如果係亞裔嘅美國人咧，通常佢哋如果有個精神病嗰啲問題嘅咧，只有28%咧，佢哋去揾精神病嗰啲服務嘅啫。
One of the greatest reasons for this is mental health stigma.
所以呢啲咧就好多即係因為佢哋啲精神病嗰個名咁。
Mental health stigma is the negative or discriminatory attitudes that others have about mental illness.
佢話好多時咧啲有精神病嗰啲人咧，人哋都會誤會你咁。
So what are the causes of mental health stigma and why is it so prominent in Asian culture?
佢話最大嘅問題喺嗰啲精神病喺個亞洲裏點解咁大嘅誤會咧？就係
One of the greatest causes of mental health stigma is culture.
因為我哋嘅傳統。
The term model minority is a stereotype in which Asian Americans are perceived as successful and the minority group in which other minorities should take after.
OK， 因為我哋好多人都以為亞裔嘅人咧，佢哋都非常之成功咁，所以都唔可以話有其他嘢嘅。
Under the model minority myth, Asian Americans are often perceived as smart, hardworking, overachiever. Growing up, I heard all of these things. I was called overachiever and nerd a lot. Have any of you been called anything else, and how did it make you feel?
OK， 佢話即係亞裔人咧，佢長大嗰時咧，好多人都話佢哋又聰明啦，又話好勤力做嘢啦，同埋即係非常之做乜嘢都要非常之成功咁噶啦。你哋長大嗰時有冇聽過呢啲咧？因為我就長大嗰時都係咁嘅。
So the thing is that the characteristics I named aren't necessarily bad characteristics. So even though the term model minority may sound like a positive thing, it's extremely harmful because not everyone fits into this box.
佢話雖然我哋即係好成功嘅少數民族咁啦，但係好多人都好難做到咁嘅，俾人睇到咁好嘅。
Not everyone considers themselves smart or hardworking, and because they don't fit into this box that society has created, this can lead to feelings of inadequacy, lack of individuality, and lack of bicultural sense of self.
佢話因為好多人咧，佢哋都話又要非常之聰明又要好勤力咁做嘢，但唔係個個人都做得到嘅，所以有時咧就比較困難啦，對佢嚟講。
And because of this pressure of being the model minority, Asian Americans may feel even more reluctant to admit that they have a problem.
因為我哋個個都以為我哋中國人咧，個個都係一個模範嘅少數民族，但係有時做唔到嗰時咧，咁我哋都好難可以話自己有精神病啲咁嘅。
Another reason why Asian Americans may feel reluctant to admit that they have a problem is because of the idea of stoicism.
另外嗰個問題咧就係啲中國人咧就話佢對亞裔人咧話佢有嗰啲即係Can you explain that? You probably go further on that.
Yes. So the idea of stoicism, it's the belief that one should endure pleasure or pain without showing any emotion.
OK， 佢話咧我哋應該咧就係好忍受到痛困苦都唔話可以話疼痛咁。
This is a common ideology among Chinese migrants whose practice of stoicism helped them to overcome economic hardship and discrimination in order to achieve success.
呢種咁嘅 忍受到即係好多即係點啊辛苦啊好勤力咁做工啊，咁咧就好多中國人咧都係因為我哋係移民過嚟，都係咁唔同個即係一起咁就忍受到呢啲咁嘅辛苦，然後至成功嘅。
So this I can suffer through anything mentality, again, is another characteristic that doesn't necessarily sound like a bad thing. Stoicism is actually perceived as a positive trait in Chinese culture.
因為咧嗰啲咁嘅艱苦啊，咁咧佢哋對中國人嚟講係一個好嘅個性嚟嘅，因為好多中國人咧佢哋都係不停咁好辛苦咁做工啊，然後至成功嘅，佢哋都唔怕辛苦嘅。
But again, this further perpetuates the idea of suffering in silence and that the display of emotions is a sign of weakness.
OK， 所以我哋即係喺度好辛苦咁受好多辛苦，但係咧都唔出聲嘅，咁咧就變到我哋咁艱苦咧，都好似唔出得聲咁。
Another aspect of Asian American culture that contributes to stigma is cultural and parental expectations.
另外個咧就係因為我哋傳統啊，同埋父母嘅盼望啊，我哋都係要咁辛苦嘅。
And especially first generation Asian Americans, there can be both external and internal pressure to achieve success because of the struggles and sacrifices their parents made to provide them with opportunity.
因為你通常都係父母嚟到呢度咧，就為咗下一代咧，佢哋都願意犧牲，所以我哋第一代嗰啲移民咧，佢哋雖然好辛苦，但係佢哋都係覺得值得嘅，都喺度做。
And this,
can I interrupt by asking you a question?
Of course.
My name is Paul Liu. I'm internal medical certified physician, and I agree with what you are saying, but I feel like that there's a big difference depending on the age of the patient that you are seeing. I think for the younger generation, they may have to meet parental expectations, so they dare not express their, what they are suffering from. But if we are talking about the elderly population, it's a totally different issue because some of them don't even want to admit that they have any mental illness because of shame and so on. So I think it's not like across the board.
Yes, I completely agree. And I think it definitely varies across the lifespan. So thank you so much for noting that.
Yeah.
Thank you.
Thank you.
OK，柯醫生咧，佢話咧，佢問佢哋通常佢睇呢個護士睇啲病人咧係咪年輕嘅？如果年輕咧，或者係有啲父母嘅即係盼望佢哋要咁做，但係如果係老一輩嘅咧，通常佢哋都唔可以即係話自己有精神病，佢哋都唔願意話將呢啲情況講出嚟。
Yes, so in specifically first generation Asian Americans, success may feel like it's so focal that they may neglect their own mental health.
因為第一代嗰啲亞裔人咧，佢哋通常都要非常之成功，所以就算佢哋有精神病咧，佢哋都唔想講，因為佢哋都係將專心喺度做佢哋所做嘅嘢，去成功咁做出嚟。
They may neglect their own health to care about others or care for others.
有時佢哋都唔理自己嘅健康，就去照顧其他啲人。
Children are sometimes expected to care for their younger siblings and elders.
嗰啲大嗰啲細路仔咧，通常佢哋有照顧啲細佬細妹啊，或者啲老人家、啲長者啊咁。
And family members may feel reluctant to share their struggles because of how it will affect both their individual and their family reputations, which further promotes the culture of silent suffering.
所以好多時佢哋都唔想講出嚟，因為佢哋要即係保密啊，咁所以佢哋就唔想講出嚟佢哋嘅真正嘅嗰啲精神病。
So what is the impact of stigma?
佢哋而家講嗰啲stigma，佢哋有啲咩影響到乜嘢？
Stigma can cause feelings of shame, which results in delay in treatment, development or worsening of mental health illness, and increased morbidity and mortality.
有時佢哋咧就因為咁咧，佢就覺得即係好醜啊，咁就唔講，咁所以就唔去揾醫療啊，去揾醫生去治療佢哋。
I wanted to take the time to talk about some of the most prevalent mental health illnesses among AAPIs, the first being trauma.
第一個咧好大影響咧，就係因為有創傷。
Trauma can be prevalent among immigrants, and then it gets passed down to their children and their children. So this is known as intergenerational trauma.
呢個創傷咧，通常咧就係第一代嗰啲創傷咧，有時咧就會繼續流傳俾下一代咁啊，再下一代咁。
For example, a grandfather who was forced to flee his war-ravaged country may have learned to cope by hiding his emotions.
譬如一個祖父輩嘅人咧，佢哋如果係為咗逃避戰爭啊，咁嚟到呢度，咁有多時咧，佢哋會有啲嘢，有啲佢哋啲感受啊，佢哋就唔會講出嚟，即係保存住，即係。
Because of this, he is emotionally distant with his children and his children's children, which causes them to behave this way, leading to generations of emotional distance and suppression of feelings.
就係因為佢唔講，咁咧佢同佢啲仔女又會嗰啲有啲感受嘅隔離啦，咁到佢下一代嗰啲，再俾佢孫輩嗰啲或者有隔離咁啦，就會一代傳一代咁去噶啦。
Other mental health illnesses include major depression, anxiety that can sometimes develop from stress and pressure.
OK， 另外嗰啲咧就係沮喪同埋咧叫做憂慮嗰啲，咁咧就因為佢哋成日都想好多壓力，想成功啦，咁影響到佢有啲咁嘅情況。
Binge drinking, smoking, illicit drug use, and prescription pain reliever misuse are also more frequent among AAPI adults with mental health illnesses.
OK， 好多人咧，佢哋因為有時又飲酒食煙或者吸毒呢咁嘅咧，種種問題咧就會又繼續多啲呢啲影響到精神嘅問題。
Most alarmingly, suicide is the leading cause of death among Asian Americans aged 20 to 24, and this is responsible for about 33% of deaths in that age bracket.
OK， 然後自殺咧就係好大嘅問題，對啲亞裔嘅美國人嚟講，佢通常係20歲到24歲咧，33%嘅人嘅死亡咧都係因為自殺嘅。
So despite the prevalence of mental health illnesses among AAPIs, they are actually 3 times less likely than other Americans to seek mental health treatment.
好多亞裔人咧，佢哋因為咁咧，佢哋都好多時佢哋都唔去揾治療㗎。
The first reason may be because of language. In the United States, 40% of Vietnamese, 42% Chinese, 19.8% Filipinos, and 17.7% Asian and Indians are not fluent in English.
佢話喺好多時咧就係因為言語嘅問題。佢話喺美國咧，48%嘅越南人，同埋42%嘅中國人，19.8%嘅菲律賓人，同埋17.7%嘅亞裔人，佢哋都唔係好識講英文㗎。
A total of 30.9% of Asian Americans are not fluent in English.
OK， 30.9% 嘅you say Asian?
Yes, a total of 30.9% of Asian Americans are not fluent in English.
佢話亞裔人咧30.9%咧，佢哋嘅英文都唔係幾好㗎。
In 2019, 73.5% of Asian Americans spoke a language other than English at home.
OK， 同埋73.5%嘅亞裔人咧，佢哋喺屋企咧，通常都係講佢哋嘅粵語，唔係講英文
嘅。In 2018, 17.1% of physicians were Asian.
OK， 然後17.1%嘅醫生咧喺2018年嗰時咧，佢哋係亞裔人。
In a 2019 study on health barriers in Asian communities, some participants explained that many Asian Americans may prefer Asian physicians.
OK，佢話喺2019年嗰時，佢哋有訪問佢哋，如果你有選擇去揾醫生嘅時候，好多嗰啲亞裔人咧，佢哋都喜歡或者揾翻個亞裔嘅醫生。
In that same study, they spoke about perceiving Asian physicians as more understanding, culturally sensitive, and knowledgeable.
OK，佢話好多佢哋都覺得，因為亞裔人咧，佢哋比較即係明白啊，同埋可以即係溝通得好啲啊，咁所以佢哋都中意亞裔嘅醫生。
So the lack of accessibility and maybe availability of Asian physicians may also discourage AAPIs to seek treatment.
或者好多時因為佢哋揾唔到啲亞裔人咧，咁所以就防止呢啲亞裔嘅佢哋去揾治療啊、醫生啊去睇病，精神病。
Other reasons include maybe lack of available resources or services.
有時咧就因為佢哋揾唔到啲資源啊，同埋嗰啲服務啊咁。
Lack of culturally appropriate intervention models.
同埋嗰啲傳統嘅應得嘅嗰啲咩幫助佢哋嗰啲呢啲模型嗰啲咁嘅。
Some Asian Americans may prefer complementary alternative medicine like herbal remedies, acupuncture, or meditation.
有時啲中國人咧就或者想用佢哋啲中醫啊，或者針灸啊，其他嗰啲佢哋嗰啲醫療方法。
Another barrier is a lack of understanding or maybe just a different kind of view on mental illness and Western medicine.
同埋另外個咧就因為佢哋唔明白嗰啲西方嗰啲醫藥啊咁，或者唔明白嗰啲西方嗰啲醫療方法。
Asian Americans may perceive mental illness as bad karma, yin and yang imbalance, or a disturbed flow of energy. So this may lead them to seek treatment by other means.
OK，同埋佢哋覺得精神病咧就有時咧就係因為嗰啲咩陰陽啊，或者啲嘅話咩唔平衡啊，咁影響到咁樣。
Other reasons include lack of interpretation services, assistance, transportation, childcare, and health insurance.
另外嗰啲防止佢哋揾醫療嘅咧，就有時因為佢哋冇嗰啲翻譯嘅服務啦，有啲其他嗰啲幫助啊，或者冇人車佢哋去啊，或者冇人睇細路仔啊，同埋冇醫療保險。
Elderly may not want to bother their working children for assistance, and they may not even want to take off work for an appointment.
OK，因為佢有時就唔想呢啲仔女去即係去請假帶佢哋睇病啊，咁所以都唔想去睇啦，唔講俾細路仔知啦。
So what can we do as providers and a community to break mental health stigma and improve access to care?
咁我哋做嗰啲醫療人員咧，我哋可以點樣幫助呢啲人去即係多啲或者去揾醫療咧？
As providers, training in cultural responsiveness, not just for mental health providers, but for medical providers.
佢哋即係幫助啲醫療人員啊，佢哋點樣訓練佢哋明白佢哋嘅傳統嘅反應。
Providing culturally sensitive treatment and tailoring treatment to individual needs.
同埋咧俾啲服務佢哋適合佢哋傳統嘅比較即係敏感嗰啲咁嘅醫療。
Awareness on mental health stigma among AAPIs.
OK， 同埋咧就俾佢哋知道啲長者佢哋有時嗰啲有嗰啲亞裔嗰啲人咧，佢哋有呢啲精神病嘅知道有啲精神病咁嘅問題。
Administration of depression and anxiety screenings at primary care clinics.
OK， 當佢哋入去即係家庭醫生嗰度咧，就開始問佢哋睇有冇沮喪啊，同埋憂慮啊嗰啲檢查佢哋有冇呢啲方面嘅問題。
Having complementary alternative medicine available.
同埋有啲或者叫做咩免費嘅其他嘅醫療方法俾佢哋。
And extending telehealth and translation services.
或者有時可以視頻嗰度咧，同佢哋睇病啊，同埋俾佢哋有翻譯咯。
As a community, we can work to raise awareness, support one another, minimize shame, and empower one another, educating yourself and others, and talking openly about mental health.
OK， 希望經過呢啲咁嘅我哋呢啲咁嘅教育咧，就希望大家都明白有呢啲問題，大家支持大家啦，同埋唔好覺得話好羞恥啊，同埋可以知道我哋如果有需要嘅咧，大家都互相教育大家，同埋大家都可以即係可以講出話有精神病嗰啲問題可以講得出嚟。
Finally, I just wanted to include some resources from Anxiety and Depression Association of America, which can help individuals connect with mental health providers and therapists who are Asian.
OK， 最後咧，佢講下睇下有冇啲即係亞裔嗰啲精神病嗰啲有啲咩服務可以俾我哋嘅。
And that concludes my presentation. Does anyone have any questions, comments they'd like to add?
咁咧就講完我呢個講座啦，咁你哋有咩問題啊？有咩要分享嘅咧
？I have some questions about health partnership clinics. So,
yes,
since Fountain of Life, we serve an elderly population, and some of them are immigrants, permanent residents, some are naturalized citizens. But we have a small percentage that are overseas visitors. So are those services available to overseas visitors, and how would that work? And what if they're Missouri resident versus Kansas? Thank you.
Yes. Thank you for the question. So if they are Missouri residents or they are just visiting from a different country, the only other step that they have to do to be seen is to meet with our financial aid coordinator. Her name is Diana. So that is about an hour-long appointment, and she can assess, the household income and then determine where they fall on the sliding scale fee. So that's the only additional step that Missouri residents and overseas visitors would have to take in order to be seen at Health Partnership Clinic. But yes, we can see those folks.
OK， 佢哋頭先問個問題咧，就係因為好多人咧，如果呢度係公民或者叫做咩永久居民嘅咧，佢哋都即係有權嚟睇啦。但係佢有時有啲人咧就喺外國嚟呢度即係探親嘅咧，咁佢哋有冇權嚟睇咧？佢話得可以睇，但係佢哋咧就或者係先去見下財政嗰個管理人員，大概1個鐘頭咁，就睇下佢哋嘅家庭嘅收入點樣，咁然後都可以去睇呢啲精神病㗎。
Do you have translation services for people who don't speak English at your clinic?
Yes, so we don't have we don't have anybody physically translating, but we work with a translation service. It's a telephone service called Propio, and they are able to translate in any language.
Okay, thank you. And also, can you give us some suggestions or give the family members of a person who has some type of mental illness as to how they can initiate the process of leading them to be seen by a psychiatrist or psychologist? Because I think that is the hardest first step for them to take.
Yes. And I think sometimes it's a struggle because mental health illness is not something that is seen, right? It's not like, you break your leg and you have to go to the ER and get it treated. A lot of times I have to explain to my patients who might be resistant to treatment or resistant to medications. I explain it like this, that mental health illness is caused by a neurochemical imbalance in your brain, right? So that neurochemical imbalance doesn't correct itself. And medications help with that. So that's how I explain it to my patients who may be kind of resistant or reluctant to seeking treatment. And it's kind of like a diabetic who needs his insulin, right?
Right.
So that's how I kind of get into it. And it helps. It helps them kind of think of it differently, that even though you can't see it, there is something still physiologically going on and that needs to be addressed.
Right. I agree with you. I usually just tell the patients that the mental illness is not something bad you did, but it's just another form of illness, just like high blood pressure and diabetes and so on. So try to, lower their sense of guilt and then slowly lead them on to clinical exam. Yes.
Yes, and it goes back to that shame, that shame part of it. So sometimes therapy can be helpful too, just sitting down and talking with someone. Research has shown that in patients with depression and anxiety, therapy and medication management work better together than either one alone. So definitely recommend therapy as well, not just medication.
OK， 佢哋話咧頭先個Paul 醫生咧，佢話問佢哋有冇即係睇病嗰時咧，通常都有個有冇翻譯呢個護士咧，佢就話有，我哋通常咧用嗰個公司叫 Appropriate 咧，佢哋有喺視頻嗰度同啲病人翻譯嘅。佢話通常話咧呢啲精神病咧唔係一種咩事嘅，有時話只係你個腦嗰度咧有嗰啲神經唔平衡。咁咧就啲神經病咧就好似一個高血壓或者糖尿病咁一種病，但係如果你坐低同啲人嗰啲治療嗰啲人員傾下偈或者知道咩影響到有咁嘅問題咧，會唔會係憂慮沮喪啲咁嘅咧影響咧，咁就或者會好啲，即係唔好即係唔去醫療，最好就去揾佢哋醫療
Thank you.
Another question?
Yeah, there's a question. There's a question in the chat talking about, wonder how can she best in a conversation with her parents.
So wondering how I can best have the conversation with my parents. I would start off by just asking how they're feeling, because depression, anxiety, a lot of mental illnesses are unique to each individual. So ask them how they're feeling, kind of what their symptoms are. And sometimes you have to kind of break it down into more simple terms, like, are you sad? Are you sad for no reason? Are you worried about things that don't necessarily, fit the situation? And then just asking how it's impacting their daily functioning. A lot of times people do not seek mental health until it starts impacting their daily functioning. So I would start by just asking them how they feel, especially if you suspect something. But of course, just also respect the way I approach it with patients. I don't try to be too pushy. Sometimes you have to let them come to you, but I would start by asking them how they feel. And sometimes it requires you to have to be open with them as well about how you feel. Does that make sense?
Yeah.
Trying to destigmatize the topic of mental health. Like I was saying before, just it's helpful to compare it to, like a medical condition, like I said, like diabetes, or like I said, breaking your leg or your arm. It's not something that can be left untreated. And even though you can't see it, it doesn't mean it's not impacting them negatively. Does that make sense?
Yeah, thank you.
Yes, and especially if it even impacts you as their daughter and your siblings, that's something definitely you would want to address too.
Thank you.
佢哋講咧就話有個人問啲問題就係點樣同佢父母傾即係講關於呢個精神病啦。通常佢話你問下佢哋即係感覺係咪有時咧無緣無故咧就好似好傷心或者擔心啲乜嘢咧，同埋會唔會影響佢哋每日嘅生活嘅功能有冇影響佢哋嘅生活嘅上游嘅咁咧就唔好即係太過逼佢哋講或者最緊要就睇下佢哋點感覺，你又點感覺，就唔好話因為呢啲咁嘅叫做負嘅人哋睇你係即係負方面嘅事情咧，就唔去揾服務啦，最好就去見醫生專家，唔好即係將佢成日都合埋，即係唔講喺個心裏邊咧，當即係呢啲咁嘅精神病咧，其實好似一個即係病嘅咁嘅，好似如果你係斷咗個腳咁你一定都去醫啦，係咪？所以你一定去揾求醫咁，就同埋希望咧就咁樣就會幫助佢自己啦，同埋唔會影響到佢啲兄弟姊妹添。
And then there was a question that came in on the chat. It says, may family members call Health Partnership Clinic to get advice or consultation regarding concerns for loved ones?
佢話而家佢哋有人問嘅問題，佢話佢想 問喺邊度啊，佢有啲佢哋自己嘅家人啊，想去揾服務喺邊度揾啊咁。
So if you call and you know you're feeling maybe distressed and you want to talk about these things, we do have therapists, and there's one in particular who does do supposed to be doing same-day visits, so you can call and ask for a same-day consultation with a therapist.
OK， 佢話如果你係覺得即係有壓力㗎咁咧，咁你就可以打電話，呢個電話佢可以約個時間，嗰日都可以睇你嘅。
To clarify, Thao, is that only if you have concerns for yourself, like if you have concerns for a loved one, a grandparent, a family member, will they also see you for consultation?
If it's for that, so let's say it's the individual who is maybe in distress and they're needing maybe some advice about helping a loved one. Yes, that is okay, but it's really it's the patient who's being seen. It's the person. Does that make sense?
Yes. So
now, if they want to make an appointment for their loved one, that's okay too. And I've had the therapist has seen you know, families together too as well.
Okay, so for instance, just as a hypothetical example, if I call with a concern for a family member, I wouldn't be able to schedule an appointment for myself to talk about what to do. It's more of for that, if that family member agrees or wants.
Yes, but I'd be open to, like, if you were to call, I'd be very open to maybe sending your call to the therapist and having him kind of talk to you about how that discussion can go and scheduling that family member. Does that answer?
Okay. Yes, I'm asking this question in case anyone has that question on their mind. I know that sometimes it takes a little courage to ask questions during these virtual meetings. So just thinking about some questions some of our attendees might be wondering. Thank you.
You're welcome.
OK， 佢問而家問題咧就係話，如果佢有一個佢自己嘅親人啊，或者佢哋啲父母啊，或者祖父母啊嗰啲，佢都有問題嘅時候咧，佢可唔可以打電話去問？佢話當然可以問，但係如果你約佢時間時候咧，就即係睇咧就當然係睇佢嗰個佢嘅親人或者佢父母或者祖父母啊嗰輩啲人，佢可以同埋一齊去，但係嗰個病人一定要同意去睇嗰啲治療，俾嗰啲專家做治療嘅。
Does anyone have any other questions?
所以仲有冇其他問題咧？
Thank you so much, everyone. I'll send that information to Jennifer to send that out to you all. Have a good day.
OK， 多謝各位。然後佢會將嗰啲資料查到之後咧，佢就會俾阿 Jennifer， 然後 Jennifer 咧就會俾你哋將啲資料俾你哋噶啦。多謝。
Bye.
Thank you.
Thank you.
Bye.
Thank you.